to the Let's Talk series. The Let's Talk series is a 30-minute video discussion between myself, Dr. Becca, Dr. Amanda, and a practitioner who understands pelvic health on topics pertaining to women's health and wellness. This series was created to help women navigate their pelvic health wherever they are on the path of womanhood, to advocate, navigate, and collaborate together with a holistic team of allies. Pelvic health healing is multidimensional, and the best outcomes occur with a team-based approach. We invite you to tune into our monthly series to learn more about your pelvic health and engage with our community partners. So today's speaker, we have Dr. Jen Rubi. Jen is tuning in all the way from Hawaii. Well, she's in California right now. She practices currently out in Hawaii. So typically, like I said, we do these topics and these talks with some local practitioners, but Jen has a very special experience in breast cancer rehabilitation at the Women's Hospital, and just general oncology. I know you see other gynecological cancers as well, but for Breast Cancer Awareness Month, we wanted to kind of bring Jen in to talk about breast cancer rehabilitation and how PTs can just be a part of that breast cancer kind of rehab team. So Dr. Jen Rubi, she's an experienced physical therapist in both orthopedic and women's health physical therapy. She's currently based in Honolulu, Hawaii, and received her Doctor of Physical Therapy degree from University of St. Augustine of the Health Sciences in 2014. She's also a board certified orthopedic clinical specialist. Dr. Jen is passionate about helping women of all ages to achieve their optimal health and function. She has extensive experience in working with pregnant and postpartum women, women with pelvic floor dysfunction, and women undergoing breast cancer treatment. Her areas of expertise include pelvic pain, incontinence, prolapse, and diastasis recti. She is known for her compassionate and patient-centered approach to care. Dr. Rubi takes the time to listen to her patients' concerns, goals, and believes in working collaboratively to address each of their unique needs. Her treatment approach is evidence-based, incorporates a variety of techniques, including manual therapy, therapeutic exercises, yoga, and patient education. So I actually used to work with Dr. Jen back in the day. So she's a close friend of mine as well. So Jen, we're so excited. Thank you so much for joining us today.
Yeah, thanks for having me and thinking of me, and also like just getting this together to just bring awareness to breast oncology rehab, because it's definitely other PTs definitely like, oh, would you do? Like people just ask me on Instagram or just in passing, because it is something that's like, oh, what could we do? And I think that that's an exciting just time for that people are getting excited about it, especially since you guys are also doing pelvic rehab. It's just, I feel like, natural to like go through other women body parts, so I feel like it makes sense that someone in the pelvic rehab world would maybe eventually do it as well, just because of the issues that we're already dealing with women. So,
or even clients that have had a history of it. I think we were kind of talking earlier about clients that we've had that have either had surgeries or have a history of it, that maybe they have other, like you said, pelvic health problems. But as we're going through a history, we find this history, and then all of a sudden we realize they can't reach their arm above their head, and how that could possibly be affecting their pelvic floor as well. So how did you get into the world of breast oncology rehabilitation?
So it's actually through my current employer. They started out as more of a lymphedema clinic, and then naturally they are in the breast cancer center in the hospital, and so they were originally just getting more lymphedema, breast cancer related cases, and then they branched out to pelvic. So theirs was kind of a reverse. They were more like breast cancer, then pelvic was like kind of what they grew into. And so when I joined the team, they were like, okay, you have all this pelvic, but can you add this breast component to it? So I did like the training last year through PORI, which is called Physiological Oncology Rehab Institute, and they only specialize in only oncology rehab, which is very, very interesting. It was very in depth, and I kind of do wish like we got a lot of that in PT school too, but it's a very specialized training, and if you guys are interested, I encourage you. It was like really a great course. So that's kind of how I got started. It's really because I came in with a pelvic rehab background, and they're like, well, we started out as breast, could you do this. So it's been a rewarding experience. It it's very similar to like orthopedic based treatments, I would say, like just because it's a lot of surgeries involved. And I think just understanding what the surgeries the patients have gone through and the medications they're on is just the most important thing. But yeah, I've enjoyed it, and um, it's such a rewarding field. Yeah.
Mhm. I guess my question is, when we're saying you're a breast oncology rehabilitation specialist, is that technically lymphedema, or are there
Hmm.
two separate and someone can be specialized in one? Because I think
Hmm.
that's a lot of the time the breast cancer clients that I've had, they're like, oh, I went to lymphedema when I had like very active
Hmm.
lymphedema during my case or during my
Hmm.
care. But then, like I had said before, like it's kind of like, oh, okay, well, you're feeling better. All things have somewhat resolved. And then no one thinks about, well, what happens if we have axillary cording, or what happens if we have
Hmm.
like scar tissue that's like binding our arms
Hmm.
down or limiting trunk rotation. So is there a difference between the two?
So the training I went through, it was just specific with oncology and like breasts. But then they also have other things like uterine, pelvic stuff, courses, all these branches of courses. But I specifically just went through the breast oncology rehab route. So their training is kind of a mix of, I would say, ortho, neuro, lymphatics,
Ah,
skeletal myofascial. With CLTs, or like being a certified lymphatic therapist, they just definitely specialize on the lymphatic system, right? So whether it's like a primary lymphedema where it's like there's maybe a vascular thing going on, or like a secondary lymphedema, which is typically what a breast cancer oncology patient would be, because they're having lymphedema secondary to all these
right.
surgeries. So it's, I would say, if you were a CLT, you would probably run into patients with lymphedema due to oncology, to their treatments, but you might not necessarily um, have like all the background in oncology yet, right? Or like the treatment. So I would say the training that I went through was very specific to like, okay, these are what the drugs could do, to the patient's tissues or their cardiovascular system. Like it was very in depth with oncology.
Mhm.
And
You are very specialized. Like,
Yeah.
this is more than.
I would say it's very specialized. More, a lot of people do both though. So they would do the
Okay.
breast rehab therapist and then do their CLT training as well.
Okay.
Um, yeah, so I would say some people have both for sure,
Okay.
and they do go hand in hand.
Yeah, that's helpful for people who are wondering, like, who do I look for and how do I look for somebody kind of thing.
Mm-hmm.
So,
Yeah.
So as a PT with clients, what types of treatments or surgeries are people kind of going through that would warrant, working with a physical therapist kind of throughout that process as well?
Yeah, so I would say, I from what I've heard from talking to other therapists, I think it really depends on the area. And like I'm sure you guys experience this as well, like how doctors are referring the patients. Like, some doctors are kind of like, oh, pro PT, like let's get the patient in before their chemo, or let's get them during chemo or after chemo. I would say that where I work, they kind of send them to us in different phases of their care, whether it's like pre, during, or post. So sometimes you will see patients like before they get the surgeries, whether it's like a lumpectomy or mastectomy, or lymph nodes removal, especially if the doctors think that they're going to have like a high chance of developing lymphedema and impairments. But sometimes we see them after. So we kind of get them in all phases, but I know that that's kind of like a unique referral and like way of us working with the patients in our hospital. But yeah, so we kind of get them in all phases.
Do you notice a difference if you've seen people come to you prior to the surgeries versus someone who you're just seeing after,
Mhm.
that's maybe dealing with something like the lymphedema or scar tissue?
Yeah, because so typically, so if you get your lymph nodes removed, like you already have a risk of developing lymphedema, right? But then you add the radiation, then it kind of adds more risk. So sometimes I'll get patients, maybe let's say a year after their radiation. I mean, it's very rare, like in the way our referrals are working, but sometimes there are those people like, oh, I did all my treatments in the mainland, and then I came to Hawaii, and then I didn't know I had to do PT, and I didn't know about lymphedema. And I would say the people that we get in the front end do a lot better because we could see things developing with the tissues, and we could kind of help get them to avoid the progression of the disease. But when someone's already kind of like having a flare up, we kind of have to work on, okay, we have to reduce the arm, we have to um, do all the management. So sometimes that could take a while. But yeah, I definitely feel like the sooner someone can get in, the better. Typically, we like to see the patients even during radiation so that we could really help with tissue healing. Um, yeah.
Talk a little bit about the effects of like radiation or chemo or some of these
Mhm.
drugs on the actual tissues. Because I think that, sometimes people aren't aware of some of the secondary like side effects that
Mhm.
can come from some of these treatments as well.
Yeah, so when they do radiation, typically patients are going every day. It depends on what the radiologist wants them to do, but they're usually going every day for like 6 weeks, 4 to 6 weeks, usually 4 weeks. Um, and then what happens is like the tissue kind of starts towards the end of the radiation. It almost looks like it's kind of burned, right? Like a bad burn. And so what starts to happen is like the tissue all starts to die down a little bit just because they're trying to like kill everything, right? Good and bad. And so eventually they kind of get um, that burning and like all of that stuff, but it's really deep. It's all the way into their fascia. It's all the way um, into their lymphatics, into their vascular system. And so they do get like changes with like blood flow, with like fascial mobility. Sometimes you kind of even see the tissue almost like caving into itself, like almost like it's stuck from very deep. So if the patient's getting radiation and they're doing PT hand in hand, we can really assist with preventing all the fascial tissues from kind of like um, drawing in towards the chest wall. Um, and usually after they've done radiation, anywhere from like 2 months to 3 months, you could start seeing the lymphedema developing. So a lot of times patients aren't like sure, like, why am I here? Like, why did my doctor send me to PT? Like, it's another appointment on top of the radiation appointments, right?
Yeah.
So they're like, and so I just tell me, "Hey, doc just wants to prevent stuff." And um, but then once the 2 months hits, then they're like, oh, that's why they sent me here. And I was like, yeah, because we just gotta like kind of prevent stuff. But yeah, a lot of times patients aren't really aware and of why they're coming in. They're kind of like, do I really need another appointment?
Right.
And so yeah, that's kind of been interesting. But at the end of it, patients are really appreciative that they started earlier, like in retrospect. Yeah.
Mhm.
I feel like that's something we've been even trying to promote with like if a client was seeing us and we know that they had like a grade 3 or a grade 4 tear, we're like, okay, come see us just to check in to like
Yes.
have a
Yeah.
baseline and then also then to be able to be like a good referral source to refer to maybe like a urogynecologist or refer back to the doctor because it does like healing does take
Hmm.
time. And if you're not looking down there and you might not even be looking at your
Yeah.
chest tissue or your
Yeah.
pec region, your muscles of your chest, you might not know what is normal or what is not normal. So that makes sense
Oh
to
yeah.
just be coming in and not automatically.
Yeah, that makes, I mean, as you say that, like it does, like a lot of patients don't know what to expect, right? They don't
Yeah.
know, like, is my tissue supposed to get dark? Is it supposed to get this red? Like, like they don't know. And, or a lot of them too, they're not focused on that. Like they're trying to, like, they have a bigger battle than what their skin is doing, right? Like, so sometimes I think it's nice for patients to just go, so let someone else take care of them and like
Mhm.
take care of the stuff that they can't really think about. Like
Yeah.
they're not really caring about their range of motion at the moment, but
Yeah.
it's something that can affect them like afterwards.
Mhm.
So yeah, and I think it's just like a very informative time for them, kind of like how you said, like, with doctors, and maybe they have the interaction with them for like 15 minutes, 10 minutes, but we're seeing them for an hour, and we're able to discuss, hey, like, joint pain, that's kind of a side effect of the chemo, or you feeling like your cardiovascular system is kind of not as good, that's also a side effect of chemo. So those things, like kind of discussing with them the stuff that the doctors might not necessarily be able to talk in their time with them.
Mhm.
Yeah.
Well, and I can imagine, yeah, that it is pretty painful as like those tissues and the skin are like kind of contracting and forming some of those like adhesions.
Mhm.
I can imagine there might even be pain that's associated with that
Absolutely.
as well.
Mm-hmm.
So you had mentioned kind of there are other systems too, how that's affected by it. So I'm imagining as a PT, right? It's always so fun when we can use our PT
Yeah.
brain and knowledge of all the other systems. I think a lot of times we get clients who come in with specific pelvic floor complaints, and then as we're talking to them, we find out they are also having hip pain or knee pain or
Right.
shoulder pain or neck pain. And that's something that we can kind of work on and address as well. And they're always like, oh,
What?
you do that too? So as like you mentioned, the
Yeah.
cardiovascular system and that sort of thing. So
Mhm.
what other types of like systems or interventions are you kind of incorporating with these? Obviously, you had mentioned a lot of
Mhm.
kind of like you're very skilled in all the manual
Mhm.
therapy techniques for helping to just help with pain and range of
Mhm.
motion. But what other types of goals are you working with these clients?
So yeah, depending on what's going on, like some patients are like, oh, I want to get back to running, right? But depending on the chemo drug, there's some that it does affect the heart directly. So you don't really, especially if they're on that drug, then you kind of want to advise them on like, hey, this is the amount you should be increasing. Like you can't really go back to like kind of like with post-op knee surgery, right? Like, okay, you can't just run 6 miles tomorrow. Like, so it's a very same type of approach, except there's definitely more cardiovascular component to it. So we usually do like kind of like a mini like stress tests where the patients so Pori the has a guideline where they have like, okay, at this minute you're going to increase it, and you're trying to get the patients like, rate perceived exertion, and like, is their heart rate changing, is kind of all those things. And then based on that, then you might say, hey, you could only do 3 minutes, and so at home just work 3 minutes, like, and kind of give patients like a parameter to work with, and to work towards. But there's certain drugs with the chemo that you have to be very mindful of how that's affecting the patient's heart, because they could eventually, if they're not being careful, they could have congestive heart failure. So I mean, you don't want to like scare the patient and be like, hey, you don't want to get, but just kind of like, hey, your heart has to work a little differently to get itself where it was, right? So and just being mindful of the systems. But it's kind of, I would just say, similar to like, training for like a marathon after knee surgery or something like that. Except there's like definitely more heart related. I think that there's still a lot of areas of growth though in terms of research in this area, because there's not really like a lot of like, oh, how, what's a exercise protocol. So Pori just kind of did their best with like getting, the information that is out there to kind of figure out what is the safest way to get patients to back into their cardio health.
Mhm.
Um, that's definitely one. A lot of it ends up being a lot of pain management too, just generalized pain management with the joint pains that they experience. Um, a lot of times patients will be like, I don't know why, but I just have like pain all over my hands, or I have like neuropathy, or I have like knee pain, or I used to have right hip pain and it's really bad now. Like, so a lot of times there's like little things like that that pop up that eventually kind of build up over time. So just kind of doing generalized pain management too with those things um, is very important. Especially, I would say there's some patients who have to have multiple surgeries. Like it's not just like a one and done. Like they're getting 3 surgeries maybe at their chest, and maybe they also had to get a hysterectomy too because maybe they're BRCA positives, right? So there's generally like a lot more surgeries involved, I would say, compared to like when you're just going to like regular, like I got my shoulder done, but so and you're kind of following that patient through that whole thing. So, they could be seeing you for a year, maybe 16 months, maybe 18, or, once a week to once a month, right? But um it's definitely like following them, and it's different. Like it's not just going to be like, oh, how's your chest, but it's like, oh, how are you feeling? And then they might be like, it might not be, the chest might not be the topic at all, even though that's what they're seeing you for, but it's just that they're going through other symptoms. I would say generalized pain is a big one. They just have a lot of pain from the chemo, right? So
That's what I was
yeah.
kind of wondering. Of like, even if somebody did have breast cancer, I'm not informed as much as I feel like we all could be as pelvic specialists specifically who work with our
Mm-hmm.
men and women with different cancers. But like, how can we help somebody who's had like and had breast, surgeries or breast treatments, to understand that like stuff is still going to happen like down there too, like at their pelvic floor
Mm-hmm.
or like in their
Oh yeah,
pelvis.
yeah, yeah.
I think you said it too, of like they might have had a chest surgery and a
Uh-huh.
hysterectomy, but it's so interesting how like it's like, well, which one do you pick? Not that you have to pick one and then leave
Mm-hmm.
the other, but that they all kind of go together.
Yeah, so well, it kind of, yeah, it's tricky because I do both. So I'm like,
Amazing, Jen.
but I'll tell
Women of many
patients,
talents.
We
Let me
need
tell
you.
but I'll tell
We
patients,
need you.
hey, like maybe you should like I'll refer them to another pelvic therapist, because I'm like, hey, if I'm
That's
seeing
great.
you for your breast, like, I mean, this is a separate issue. It's related, but I think you should definitely just be seen by another practitioner, and I would encourage them to see someone if there's something that's like pressing, right?
Mhm.
Um, but yeah, because it is definitely related, and there's a lot of symptoms that, like, for example, like if someone's had radiation, they could start developing back pain, pelvic pain on that side because
Oh,
of that radiated tissue on that side, and affects all that. And then there's also like the gastrointestinal effects too from chemo. So they might be experiencing constipation, all those things, or just all sorts of things that they don't think it's related. But it's like, hey, I think it's all part of what's going on with your
right.
treatments.
yeah.
Wow.
Right, and I
Yeah.
feel like that happens with anyone, right? When they're coming in, there's a specific complaint that they have, and then as you're talking to the person, and sometimes it's almost like we're the ones that are helping to connect the dots for
Yeah.
them, where you
Mm-hmm.
see kind of the light bulb go off when you're asking the questions, and they're like, you know what, now that you say this,
Mm-hmm.
I realize that, after I got this surgery or this procedure
Mm-hmm.
or whatever, that, that kind of triggered this event,
Mm-hmm.
which now led me to where I am too. So
Mm-hmm.
sometimes it's, like you said, there's a much larger battle that sometimes people are kind of going through.
Mm-hmm.
Um, to where there's, they're seeing this doctor for this, or this person for
Right.
this, or this person for this, and they know that
Yeah.
there's all these things, but being the person that can help
To
kind of bring it
connect.
all
Mm-hmm.
together and recognize how
Yeah.
it's all kind of,
Yeah.
still kind of interconnected and interrelated. And I think it's great with your background that you are able to kind of be that person to help, people not only just from like the breast cancer rehab component, but help them get back to maybe some of their fitness goals or
Mm-hmm.
activity goals, or help them feel more comfortable with their day-to-day, or
Mm-hmm.
with any like pelvic floor issues that they might be experiencing with it too.
Mm-hmm.
Um,
Yeah.
Yeah. Oh, and this is
Gotcha.
kind of like, I mean, still topic, but I'm kind of like, oh, this is gonna, like, I think this is interesting, but um, like little things like bra fit, right?
Right.
Like what bra should I be wearing? Like what is a comfortable bra for me? Like, and so that's sometimes like even just like a couple conversations were like, okay, did you like the bra that or did not work out for you? Like, and your preference changed so much, like after you've had 2, 3 surgeries, like, you have scars to consider, like it's, or, you don't like pressure, or the sensations feel different because you don't have sensation, or like it's all different. So that's another thing that I think a lot of patients end up talking to their breast onco rehab therapist is like, what do I do with my bra? What bra do I wear? Like, how do I sleep? Can I sleep face down now? Can I not? Or like, do I ever, like,
Yeah,
like
right.
there's so many things. Or I don't feel like going on my side because I, like, people have a fear of like, is my implant gonna move to the other side? Like they're just like
Yeah.
all those things. Or they, they have to consider what type of, do they want an implant? Do they want like a deep flap, like where they have abdominal fat come towards the breast? Like there's just so many choices that they have to make in a short period of time. And it's not easy. And I mean, you're just changing, your body's going to feel different, right? So it's like, and no one can really make that decision for them, but just, hey, like whatever feels right for you, like there are options, and you just have to be like a supportive sounding board at that
Yeah.
point, right? Because they're getting so many, they have 3 4 doctors that they're seeing. So it's like, okay, well, I'm just going to be the listening ear here, like, and just try to hopefully reassure the decisions people have to make. That's
Yeah.
pretty time
Well, even like
sensitive.
the other day, I was working with a client who has survived breast cancer, multiple times, and she's several years out. And, we were talking about like her goal is to be more athletic and get back to running. That was like a love of hers,
Mhm.
but she keeps beating herself up of like, why can't I just go run my, 5 miles? I used to do half marathons and everything. And I like, there was a moment where you saw a light bulb and also the mental like weight come off of her when I was like, all of this has been going together and it's not your fault. And she was like,
Mhm.
I just thought I wasn't motivated enough and I was just
Mhm.
lazy. And I was like, there was a lot of things that maybe built you up to that sense of laziness,
Yeah.
but it might have been from like medications like years ago, but
Mhm.
still, like if the ability to properly rehab from that wasn't
Mhm.
offered, unfortunately I said, yeah,
Yeah.
we gotta start this bus back at step one. And she was like, you just
Mhm.
saw like the mental, like I just saw it and I was like, oh, like I even like
Yeah.
just yawned with her almost. It was like,
Yeah.
oh, like, but PT, I think that's what PTs and OTs and speech therapists are great at, is like you said, like being the sounding board to be like, hello, like, do we
Mhm.
see where this is going, or can we bring all this in and see how it's all been going together? So yeah,
Yeah. Yeah. Because they're like, I mean, you see them so often. Like
right.
you're like, we end up being a healthcare provider that they're comfortable, like kind of talking
Oh
about
yeah.
all these things too. Um, but yeah, just, and that's another thing that with treating patients, like sometimes depends, right? Sometimes patients come in like kind of overly worried, or like, hey, am I doing all the right things? And it's like,
Mm,
hey, some of this is just time. Like you have
right.
to heal. Like it's not that you're not doing anything, you're doing everything that you're supposed to do. And you just have to like let your body do its thing as well. So I kind of understand like what you mean, where she's probably feeling like it's her, but it's like, hey, it's gonna take time. And like you said, you weren't offered the support at the time,
Right.
and it's never too late. Like I
Right.
do see
Exactly.
patients that are like, I didn't have this 15 years ago.
Mhm.
And I told her, well, to be fair, like I feel like oncology rehab is somewhat newish, right?
Yeah.
It's like
Yeah.
maybe it is like 10 15, I would say 15 20 years old. Like there's, and not everyone's specializing in it, so we do need, I feel like, more people to be doing it. Uh and I think it helps to like get the additional training. Like I don't think I would feel as comfortable if I didn't, just because it's like the language of all the lumpectomy, mastectomy, like all this
Yeah.
stuff. I'm just like,
Yeah.
I would be like, I don't know what, I would be intimidated by the treatments that these people are getting, that I would be
Yeah.
like, I don't know how to help them. But
Right.
I feel like understanding just the language and like the processes that they're going through is helpful, because it's like you can't really hold someone's hand if you have no idea what they're going through. And I still don't know because I haven't gone through it, but just to have like, this is what they're, the run around they're getting, is kind of helpful, so that you're not you're contributing when it's important, and you're kind of taking yourself out when it's important. And I think that that's an important balance that I've learned with oncology specifically. It's like, hey, I don't need to have the answer for everything, because I don't, like, I'm just like, I just feel like I'm playing a small part, a big part, but a small part in this whole scenario, and I don't have to have the answers, and I just need to like add when I need to add, because it could be overwhelming. Like, I can't be like telling, oh, and you can get lymphedema, and you can have like, like if I say that all in the first visit, like the patient's going to be like, what? So I just sometimes have to like
Right.
feed it as it's, as I
Especially
can.
when a
Yeah.
lot of the time they're not hearing those, like, these are the things that could happen from
Mhm.
their oncologist. Like, I think people like want to
Mhm.
hear those things from the oncologist, but there's just not time, and that's not
There's not
like
time.
the
Yeah.
specialty. I mean, the oncologists obviously know that, they're very
Yeah.
intelligent providers, but like the time is not there. It's like, well, my goal is to help you surgically remove cancer,
Mhm.
or
Their priority is like higher.
Exactly.
Mhm.
So
And
it's a feeding thing for us as therapists.
yeah, I just have to, and it depends on where the patient's emotional state is, right? So it's like if they're already seeming overwhelmed, like I might not really tell them about lymphedema today. Like, like I don't think this is a topic that we should talk about. Like I
Yeah.
might not break it to them honestly till like 4 sessions later. Like, hey, just because they're worried about other stuff.
Other
And it's
things.
like, yeah.
Yeah.
Yeah, you have to always take into account, I'm working
Mhm.
with people in any setting of,
Mhm.
not only their physical body, but their mental, emotional kind of readiness to hear some of this stuff too. Because,
Mhm.
yeah, I can only imagine how scary and overwhelming it must be to be going through it.
Right.
But if I were seeing you, Jen, I would feel very comforted by,
Thanks.
everything that
Well,
you're
I hope you never have to
experiencing.
see me for this.
Yeah.
That's not something.
Yeah,
But
hopefully not. Yeah, but
But another thing too that I was gonna say is like a lot of people when they think of lymphedema, they think of like, big legs, right? So they kind of
Right.
like get scared. So sometimes I'm like, there's different kinds of lymphedema. And like I have to kind of explain to them because their thought of like lymphedema is like, oh my God, like so my grandma's arm or like, so they'll
yeah.
have a
Right.
reference and I'm like, no, no,
Before.
no, no. It's like
Right.
a little different, like um and you're here right away. So I have to like just I don't know, I just feel like just to be careful of how it's presented, because people will like, oh my gosh, like my arm's gonna look like that, or my chest is gonna look like that. Um, and just kind of reminding them, hey, there is something we could do for it. Like that's why you're here. We can manage this. Yeah.
So I know, like, I feel like the PT world is pretty small.
Yes.
The pelvic health world is even smaller.
Mhm.
I'm sure the breast oncology rehab world is
Right?
even smaller.
I'm
Yeah.
like, I can't, yeah, I mean, luckily there is well, and I could send you guys the link, but Pori does have like a directory
Okay, yeah, I was
of
gonna
people
ask.
that
Yeah.
do it. There's like Facebook groups of like that, like pelvic rehab stuff has Facebook groups, and I think there's definitely Facebook groups or things like that for breast rehab. Um, and yeah, it is very small. So like I mean, I think in Hawaii, I mean, there's definitely 3 of my coworkers that do it. And then there's probably like another couple people that do it in another hospital, but it's very small. And like we do like know each other, even though it's like we're in different systems and everything. Yeah, and I think that kind of keeps it special in a sense, but I do wish that there was more breast rehab therapists, because right now, like at our facility, like people have to wait 6 to 8 weeks sometimes. We do try to have slots open for like, okay, they just had surgery, get them in, and we'll try to do the best we can, but it's a long time to wait, especially if, things are progressing. So,
Mhm.
um,
Yeah.
yeah,
Well, we'll definitely include that information
yeah,
when we set it out, the link to that directory,
hmm
because even as
Gosh.
pelvic health therapists are just people, women knowing other
Right.
friends, family,
yeah,
clients that might be going through it to be able to help kind of guide them to maybe some specialists, even in our area. But if anyone's listening and you're in Hawaii,
Yeah.
Jen's a gal.
Jen is your
Yeah.
gal. But yeah, we'll have to kind of take a look and see even in our area if
Right.
anyone's around and maybe
Yeah, and then link up with
people.
those folks and
Yeah, because I
figure
wouldn't
out.
have even known where to start looking
No.
for it.
I would have gone like right to lymphedema
Yeah.
thing, but this is
Yeah.
so inclusive of many
Mhm.
other things as well.
Yeah, and then like I said, some people specialize in a lot of other types of cancers, like head, neck. I mean, I haven't even
Wow.
done head, neck stuff, but there's that kind of training. Yeah, so there's just so many types of,
Yeah.
and I think it is a growing field. It'll continue to grow. Are you guys, I was just curious, are you guys interested in doing breast rehab for yourselves?
know.
Oh, well, not for
Are you?
yourselves, but for,
I know.
I
My
mean,
brain is very full right now.
I know, right?
Yeah.
You
yeah.
get,
Well, I think it's definitely something that, like I have a client that I've been working with who she had like the deep flap and everything. And she has seen like a lymphedema fill, like she's done a lot of that work. And now we're working together mostly more on just a lot of kind of overall general like tension, like abdominal wall tension. And she was getting some leakage that she was never dealing with before that potentially were a result of some of kind of the scar tissue.
yeah,
She did have such a large like abdominal scar,
yeah.
deep flap surgery. So something that I definitely had to do a little bit of homework and
Right.
reading up on beforehand.
Did she end up
kind of-
getting radiation or she didn't need radiation, right?
I
Probably
don't
not.
think so. She,
Prophylactic.
I think it was, yeah. I think it was
Yeah.
mostly prophylactic for the broken
Okay.
gene.
Okay.
But for like her reconstruction and stuff like that. But she had a couple of complications with a few of her surgeries.
Uh-huh.
So she had multiple surgeries,
Oh, yeah.
infections and like different things that
Right.
had happened as well. So, but it was interesting even working with her, like she, again, just talking about like the things that are also going on that people
Yeah.
don't recognize as being a part of it. And she didn't even kind of share this with me at the beginning, but when I saw her a few weeks ago, she's like, I was trying to think on the drive here of like, okay, like, how have I been feeling? Like,
Yeah.
what am I feeling of as far as like updates to give me? And she's like, I realized that she's like, I'm not getting the numbness in my arms
my
when I'm
gosh.
sleeping. She's like, I would always wake up and have all this like tingling and numbness in my
Right.
arms. She's like, and that's gotten so much better.
Wow.
She's like, I always just used to think it was like because of the way I was sleeping or this or that, but we've done a lot of work around like her rib cage, her thoracic, and her abdominal wall, and that
That's amazing.
has helped a lot, even with like the tingling in her hands that she would get when she was sleeping.
impressive.
So
Have you, oh, just, I know like you're seeing her pelvic, but have you considered like, or checking out her chest, or have you?
yeah, I mean,
Or
I
would she be
do
all right with that?
work around some of her chest
Yeah.
wall,
Uh-huh.
and like sternum and that sort of thing. I've done, a lot of different like rib cage, sternal, neck kind of stuff. And even just some like neural kind of nerve glides,
Yeah.
mobilization around her like thoracic spine. Just because I was noticing a lot of limitations through her like rib cage, chest wall, thoracic area as well.
Yeah.
Um,
Yeah, because
but
that's, I mean, it's kind of, it's funny because I do see pelvic rehab, but I see them with specifically for their breasts, and then I've been
yeah,
referring for the
yeah,
pelvics. So I'm like, oh,
yeah,
this is kind of interesting. Like,
yeah.
yeah, like if that you're seeing them on, like you would be
The
the person I
reverse.
would
The
be
pelvic
referring
side,
to, right?
yeah.
It's like, oh, go see Becca. I'm gonna just take care of the top. She'll take care of like
Exactly.
everything below
Exactly.
the waist. But it's just that's why I think sometimes they might need two different therapists.
Yeah,
Because it
yeah.
could be a lot to just,
Yeah, because she's had, she's worked with a lymphedema specialist and done that. And I mean, I know very general kind of
Right.
like lymphatic kind of stuff. She sometimes still feels like she gets a little bit of like swelling kind of around her scar, that sort of thing too. So, but yeah, it's been definitely a learning experience for me and super rewarding
yeah.
working with her.
Yeah,
To just
you're
kind of
helping
open
her
my
so
eyes
much.
more.
I know you're helping her so much.
Yeah.
And I think that's the thing with any therapist that you see, whether it's physical or OT or mental health, like somebody who does look at it holistically, like, and is a good referrer, is that right? Referrer to like other people who can be
Yeah.
in your circle and collaborate. And I know that like that's that's one of the goals of Breathe Life PT. And I think that's what we're so good at, of like finding these resources for people. Like
Mhm.
we found, well, we know who you are in Hawaii, but like, we
Yeah.
need to make sure that we find those resources here.
Oh
for our
yeah,
clients.
for
Because it
sure.
all goes together.
Yeah.
For sure. That'd be great.
Well, thank you, Jen. You had mentioned people will sometimes like DM you on Instagram or that
Mhm.
sort of thing. You know, like I said, I know
Yeah.
you're out in Hawaii, but if people ever
But
want
still,
to,
yeah, I'm available for information or like just
Absolutely.
set resources or, that's, I'm happy to help anyone if they need any type of
okay.
connecting the dots, like we said.
Yeah, yeah.
Yeah.
For sure. All right. Well, we'll include that information in the information for the video too. So people, if they want to reach out to you or contact you or have questions, it'll all be
Yeah.
there. So
Yeah. I hope it was helpful and I hope it helps somebody in some way,
yeah,
whether it's a
absolutely.
PT or a patient.
yeah. For
Yeah.
sure. All right. Well, thank you, Jen.
Thank you for the
Thank
time, Jen.
you. Yeah. Thank you. I'm glad we did this.